Trauma to a young, permanent tooth can lead to a complicated crown fracture that involves loss of the hard enamel layer, the underlying dentin layer, and exposure of the dental pulp. The dentist will examine and evaluate the underlying socket and ridge to make sure that they are not damaged. As the roots of the immature tooth are still developing, one of two procedures may be performed before restoring the tooth. Either pulp capping or a shallow pulpotomy, both of which are done to preserve and protect the pulp so that root development may continue to mature. A final bonded restoration is placed after these procedures. After treatment, the dentist will use radiographic evidence at 6 to 8 weeks and 1 year to monitor for continued and completed root development in the young adult tooth. When the tooth reaches full maturity, non-surgical root canal treatment and crown placement may be indicated.